Bipolar disorder, also known as manic depression, is a mental health disorder characterized by a swinging variation in mood. Sufferers experience both episodes of elation and depression. The condition may significantly impact an individual's ability to function, frequently causing detrimental effects on home, school, and work life. Amongst the worst cases, episodes of self-harm or suicide may be present. Up to 20% with bipolar disorder successfully commit suicide, an unacceptably high number. Therefore, improving our understanding of this mental health condition is imperative to help us identify the warning signs in ourselves and our loved ones. So want to learn more about bipolar disorder? Keep watching as we'll break it down here. So let's talk about mental health. My name is Dr. Hart Pinto, and in this series we aim to break down the social barriers to mental health. At JHP Medical, we make weekly information videos designed to increase awareness and help you better understand your medical condition. So if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. Okay, so what is bipolar disorder? Bipolar disorder, previously known as manic depression, belongs to a group of mental health conditions known as mood disorders. This condition gains its name from patients' swinging polarities in mood, ranging from elation to depression. The term bipolar literally means the two opposites. Some consider the symptoms of bipolar disorder to be amongst the most severe and persistent among psychiatric illnesses. The condition can have a significant impact on individuals' social and family life. Suicidal thoughts and attempts can emerge in the most severely affected. So who gets bipolar disorder? Approximately 1 in 100 people will be diagnosed with bipolar disorder at some point in their life, suggesting this condition is relatively common. The condition equally affects men and women, usually presenting in the late teens to early 20s. The condition may affect people from all ethnicities and all walks of life. Why exactly bipolar disorder occurs is not fully understood. However, we think the condition is related to abnormalities in the brain's biochemistry. Bipolar disorders tend to run in families, suggesting also the presence of a genetic link. However, no single gene is responsible for the condition, and a complex interplay of genetic and environmental factors is likely. There are, however, several factors that can trigger episodes of bipolar disorder, including stressful life events, poor sleep, and physical illness. What do people with bipolar disorder experience? People with bipolar disorder experience fluctuations in their mood, from elation to depression. Symptoms of bipolar disorder will therefore depend on which mood you are currently experiencing. So let's look at the symptoms of elation, known as mania or manic episodes. Whilst everyone will naturally experience periods of elation in their life, like when exposed to happy events, manic episodes are different. During manic episodes, individuals experience feelings of being very high and overreactive. Symptoms are persistent and often out of context with current events. Individuals may express rapid changes in mood, from highs to irritability or even anger. We can break down episodes dependent on severity into two distinct groups: hypomania and mania. Hypomania is characterized by greater than 3-day history of persisting mild elevation in mood. Individuals feel more energetic and show an increased level of activity. A resulting knock-on effect on their sleep patterns may occur as individuals experience a reduced sensation of tiredness or the need to rest. Individuals during this phase are usually more talkative, they may be overfamiliar, and may demonstrate an increased sex drive. Now let's look at mania. The definition of mania includes a greater than 1 week of mood elation or increased irritability. In manic episodes, there is a significant impact on day-to-day life. Again, patients demonstrate increased levels of energy associated with a significant reduction in sleep and the potential for exhaustion. An increase in sexual disinhibition causes sexually explicit behaviour, including flirtation, inappropriate touching, or sexual propositioning. Individuals may go on to experience psychotic symptoms including auditory hallucinations. Individuals may experience the feeling of increased creativity and intelligence. Common delusions include the presence of superhuman powers, a requirement to complete a mission, or the belief they have great wealth. This can lead individuals to go on large spending sprees, which can lead to considerable debts. During episodes of elation, individuals may dress inappropriately, frequently in bright or even outlandish colours. There may be a noticeable deterioration in personal hygiene also at this time. Generally, an individual's insight into the episodes of mood elation are usually poor. Separate episodes of depression will also occur. Individuals will display the same symptoms as those experiencing clinical depression. Depression also can have dramatic implications on day-to-day life. Doctors characterise depression as pervasive, unshakable low mood, plus a reduced interest in normal activities. We've taken a detailed look at the symptoms of depression in a previous video. If you want to learn more, I will provide a link in the description below. How will my doctor diagnose my bipolar disorder? Bipolar disorder can be one of the trickier psychiatric conditions to diagnose, given the vast variation in symptoms patients can have on their initial presentation. However, your GP or primary care physician will suspect bipolar disorder where you demonstrate a mixture of symptoms, including hypomania, mania, and depression. Symptoms must have been present for at least 2 weeks. To confirm the diagnosis of bipolar disorder, your doctor will request a review by a specialist in mental health. And they will want to review your prior medical history and any other psychiatric conditions and medications you may be taking. Additionally, your doctor will want to rule out any undiagnosed physical illness, including thyroid disorders, and therefore is likely to request additional blood tests. So what about treatment? The recommendation for treatment will vary based on the nature of the episode you're experiencing. As always, the best treatment includes a shared decision making between you and your doctor. During acute episodes of mania, most patients will require inpatient hospital admission under specialist psychiatric care. For many cases, hospital admission is compulsory due to the potential risk of harm patients pose to themselves or others. During acute episodes, specialists prescribe a trial of benzodiazepines or antipsychotic medications. These medications aim to quickly regain control of your symptoms. If you develop symptoms of mania whilst taking antidepressants, your psychiatrist will stop this medication. Antidepressants could potentially worsen any manic episodes. If your mania symptoms remain poorly controlled, a second antipsychotic medication or lithium, a mood stabilizer, can be taken. Following the resolution of your acute manic episode, your psychiatrist may offer long-term lithium. Lithium is an effective mood stabilizer that aims to prevent any further relapses. After commencing lithium, you will require regular monitoring. Lithium levels are measured via a blood test 1 week after starting treatment and weekly until the levels are stable. Once your specialist is happy with your level, monitoring is required only every 3 months. Additionally, every 6 months, your body mass index, blood salts, and calcium levels, kidney function, and thyroid function will be checked. Whilst lithium is an excellent mood stabilizer, this medication may not be effective in everyone. Some will require an addition of a second medication such as sodium valproate. For patients unable to tolerate lithium, an alternative combination therapy with sodium valproate plus an antipsychotic medication is available. The management of depressive episodes in bipolar patients is usually in the form of quetiapine or fluoxetine combined with olanzapine. Additionally, psychotherapies can also prove beneficial in the management of depressive symptoms. So what about prognosis? Unfortunately, no cure exists for bipolar disorder. The natural history of the condition means relapse is likely, with individuals expected to experience an average of 10 episodes in their lifetime. The chance of recurrence within 12 months of the initial episode is around 50%. However, most relapses are associated with poor medication compliance. I hope you've enjoyed this video. Don't forget to subscribe and interact by giving us a thumbs up or leaving a comment down below. This supports the growth of our channel and helps educate many more people about their medical conditions. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis, or treatment. Please do not ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.